Well, thanks all for joining us here today. Very excited to make an announcement about, in collaboration with the Nurses Union, about how much we value nurses across this province. We know that nurses have put in an incredible heavy lift over the last 2 years in particular. But beyond that, they are the heart and soul of the healthcare system. And one of the things that I think we tried to achieve with today's announcement is making sure that not only that we recognized how valuable they are, but we listened and we heard from them what the potential solutions were. So I want to thank, in particular, Yvette for helping lead this. I mean, we started this a couple of months ago with the nurses think tank, and then immediately actioned the items that came out of it. So not only did we listen, we're acting. And I want a special message to all the nurses who are watching anywhere across the province. We heard you, we're listening, we continue to value you, and we will work with you to ensure that you're meeting your professional goals so that you can look after yourselves and look after the patients of Newfoundland and Labrador. So with that, I'll turn it over to Minister Osborne for a couple of comments, and then to Ms. Coffey.
Well, thank you, Premier, and I want to echo what the Premier said and thank Yvette and the leadership at the RNU for working with us and the meetings and working on the issues that are important to nurses and nurse practitioners and other members of the Nurses Union throughout the province. We want to ensure that we provide the climate to ensure that we are able to not only retain nurses but to recruit nurses in Newfoundland and Labrador. We all understand that there is a recruitment and retention issue globally. Every province in Canada, there are media stories almost every day on this issue, but we need to get better and more focused and more competitive in recruitment and retention. And the initiatives we're about to announce, or that we're announcing today, go a long way in doing that. Yvette?
Thank you, Minister, and thank you, Premier. So we're standing here today, and we have been meeting since April, when we first had our think tank on April 4th and 5th. And today is a result of the solutions that were brought forward by all the stakeholders and our frontline members, who talked about what it's like to work as a registered nurse or a nurse practitioner in Newfoundland and Labrador in the current healthcare system. The nursing shortage didn't happen overnight, and we're not going to be able to fix it overnight. And we are competing with our Atlantic counterparts. We're competing with provinces throughout Canada for registered nurses and nurse practitioners. Today, we're here to announce hope for the registered nurses, the nurse practitioners, and the healthcare workers and our patients who are currently availing of the healthcare system in Newfoundland and Labrador. We all hear the stories every day. Nurses walking away, patients waiting for surgeries and procedures, backlogs in emergency departments. Our hope is that this will give hope to our members and to the public of Newfoundland and Labrador, and that we will continue to collaborate with the government, and we all collectively acknowledge the issues in healthcare, and that we continue to collaborate and build on the initiatives that have been announced today. Thank you to the Premier and to the Minister and the Department for all the work that's been done behind the scenes to get to where we are today.
Thanks, Yvette. It just struck me that no one has actually talked about what we're announcing today. So I think you all have a paper copy, a media release of what's in the suite of options. But the suite of options include a retention recruitment bonus. It involves an incentive to become full-time from casual. It includes continuing to explore options for childcare, given the flexibility required to be a nurse in certain scenarios. It involves incentivizing locum nurses around the province. It involves support for mental health of our nurses across the province, and other options on the table that, of course, you all are fully aware of. But it just struck me that no one actually said what we're announcing today. So we'll open it up to questions.
getting time off, getting vacation. What does what you're announcing here today, what does that do for them? What should they take away from this?
Well, I think to echo Ms. Coffey's sentiment, this provides hope and optimism for the future. That, again, nothing is going to change immediately overnight, but this is a recognition by the people of Newfoundland and Labrador and this government, the value that nurses bring to the system, to the table, to society. And we recognize that there have been gaps in helping incentivize, for example, casual nurses to become full-time nurses will help take the stress and strain off full-time nurses that are often doing double shifts and other things. So this suite will help, if nothing else, show that there is a vision and a strategy moving into the future, and that we will continue to be competitive across the country. And I think this suite of options really shows that there is a want and willingness on behalf of the government to support them.
Timeline for nurses to kind of take advantage of these incentives?
Well, they're different for the different incentives, and I encourage all the nurses to reach out and make sure they're fully abreast of what's available. We'll certainly be working with the regional health authorities and continue to work with Ms. Coffey and her team to ensure her members are fully educated on what's available to them and what deadlines apply.
Day long, 800, I know that's not the exact number. The incentives for the doctors, the incentives now for the nurses. What about other healthcare professionals? Are there other?
Yeah. That's a great question. Yeah, that's a great question, and we continue to talk with allied health professionals and other health professionals who, again, have done a heavy lift over the last few years, and we continue to have those discussions.
Is there a dollar figure on how much all this might cost?
Minister?
We do have a dollar figure on this, but we have entered discussions and have met with NEAP, for example, on similar proposals. We're speaking with Allied Health and with CUPE. We've reached out, and the process is now starting with Allied Health and CUPE on similar initiatives. So, I think it's best, once we have the total package, to provide the costing, because we're still dealing with other bargaining units on incentives and so on for them.
But like the doctors, Minister, is there a number you can point to, like a top up maybe, like a daily top up similar to the doctors, or is this a little bit more into the weeds?
I think in fairness to the other bargaining units, we know what the nursing incentives cost, but I think in fairness to the other bargaining units, we have to deal with the other bargaining units and the healthcare professionals in areas where there are significant pressures on recruitment and retention, and that's what we're trying to resolve. So once we have the full package, which I anticipate should be very soon, we'll be able to provide a wholesome number.
Yeah, but it's also not as simple as when we announced the Category B, for example. So the suite of options that we announced today try to apply to as many nurses as we could possibly think about. So, one nurse may find him or herself in one option, but not in another one, or vice versa. Whereas the doctor's, a Category B site was just a kind of immediate incentive, almost per day or per hour, right?
There's some more technical things in there. I wonder if you guys can explain. What's a return service commitment for people who don't know what that is, so we can explain it to our viewers and listeners?
Yeah, sure. So return of service commitment is, will if you decide to sign for a return of service, we'll incentivize you with financially. So if you sign a return of service, you'll be financially incentivized to provide a year of service or more, depending on what option you're choosing. Well, there's anyone out there who's left who wants to come back, they can certainly apply and would be acceptable, but these are also for people who we want to retain in the system as well.
So some people could be in the system.
That's right.
Make sure they stay there.
That's right.
I just want to make sure I have an up-to-date number. Do we know how many vacant registered nurses positions that there are across the province right now?
I think that
It's over 600.
Over 600.
that was in the
And that's a couple of months old now.
I'm actually, that you might be with the
Sorry. So the last figures that we got from the department, over 615 vacancies in the province of Newfoundland and Labrador. And we also have to remember, we have another 900 who are eligible to retire in the next 2 years. And every day we're hearing stories of people just walking away from either a permanent job to go casual or a permanent job to leave the system and leave nursing altogether.
But for those at home who have recently retired, there's an option in there for you as well. We would like you back, and we'll pay for your fees if you'd like to come back.
All of these solutions were recommendations that came out of the think tank, which was all the stakeholders that came together, the regional health authorities, frontline nurses, different departments of government.
Are you satisfied with progress today? I mean, this is moving at pace you want, and obviously there's an urgent situation.
So every day we're all hearing the stories in healthcare. This is not going to fix our healthcare system overnight. We still have a ways to go. But we will continue to build on this. And these announcements, our hope is they will give hope to our members and to the people of Newfoundland and Labrador that we are still working on this, we are still engaged in discussions, and we will continue to engage in discussions for further incentives and to make sure that we are competitive with other provinces so that they're not taking away our healthcare professionals.
You're now into the middle of getting there, or where would you?
Well, the think tank was a start, and, you know, it was an acknowledgement of the issues that are going on in the healthcare system and the issues that our members are facing, and the burnout, the physical and mental exhaustion, and the issues in the system, of course. The think tank gave us an opportunity for everybody to hear the heart-wrenching stories from our members of what they are actually experiencing. And they are the ones who came up with the solutions, and that's what we have been discussing for months now to get to this day where we'll be announced. Is it enough? It's not going to be enough to fix the system right away. We need to build on this, and we need to continue to keep advocating for our patients and our members.
But I just add, sorry, Yvette, that, you know, we have looked in the long-term strategic lens as well with respect to increasing enrollment in the nursing schools, increasing enrollment in paramedic schools, increasing enrollment in the LPNs in the medical school. That's going to take time. I mean, that you just can't knit a nurse or a doctor overnight. That will take time. But we have made that upfront investment, recognizing that there's changing workforce patterns and there's a changing demographic that we need to strategically plan for in the medium and long term. But some of these short-term issues are meant to tell the healthcare workers how much we appreciate them, how much we value them, and how much we want them still in the system. And again, to pick up, it's hope and optimism for the future.
Just to note, so a lot of focus with the
The doctors. Are we able to, expect nurses from some of those? Are they also options?
Yeah, so we're looking at all options available to us between Minister Osborne and Minister Byrne. There are some licensing, we have to be honest with everybody, there are some licensing requirements that exist, and they're not going to go away. We do have to make them more efficient and more streamlined, and we're in discussions all the time, or most recently with the colleges, to ensure that we're looking at that. But there, we have to do due diligence on behalf of the people of Newfoundland and Labrador to ensure that whatever medical professional lands here is safe to practice. That can't just happen overnight. But we'll work with those groups to ensure that we're giving them the opportunity and supporting them along the way to ensure that they can practice here in Newfoundland and Labrador, whether that's a nurse, a doctor, a nurse practitioner, or any allied health professional.
For child care nurses, can you guys fill in the blanks a little bit there about what that's going to entail in the community?
Yeah, sure. It's a commitment to continue to work with the nurses union, recognizing the flexibility that's required in child care for them. I mean, you see, nurses don't work normal daytime hours, but they have the family commitments that non-medical families require. So there has to be a thinking outside the box approach to support childcare within the delivery of healthcare if we want to continue to attract young women and men into this workforce, which we do. So there's no quick solution to it. We couldn't announce an immediate action item with respect to childcare, other than this government, I think, more than any other government, has been supportive of childcare, and will continue to ensure that that vision and strategy is being applied with a unique lens to healthcare professionals.
Today, has there been any reaction? Do you have any sense of whether, say, a retired nurse or a nurse who's gone casual might be responsive to this plan?
Well, I can say that we have had some questions from our members. The devil's in the details, right? And I'd just like to add to something the Premier just said. These incentives that are being announced today, you ask what the impact will be. We are going to be doing an evaluation and to see what effect and what impact this will have on the retention and recruitment of registered nurses within the province. Just like the locum, Premier referenced a locum team. So you've heard me talk in the media about a travel team. And it was discussed in 2019 in collective bargaining. So we have agreed we're going to do a pilot with Lab Grenfell. There's an extra dollar amount, a premium, for any registered nurse in the province of Newfoundland and Labrador under a collective agreement who can avail of opportunities to go work in Labrador to help out in these rural remote communities as well. So an evaluation will have to happen of all of this in the end, at the end of a year, to see, did it work? What do we need to change? And what do we need to build on?
There's one, the bursaries and
Oh yeah, there's one more thing that we've. We really encourage, if there's a nurse out there or a nursing student who's looking to stay, looking to come back, looking to sign to stay, coming out of nursing school in Newfoundland and Labrador, please reach out to either the Department of Health or to the Registered Nurses Union, and we will make sure we'll make sure that it's streamlined for you and get rid of the red tape that could be involved in this process. This is not an announcement to not act. This is an announcement to act. And I'd like to just end by saying that this is what happens when you have collaborative relationships. And to once again thank Ms. Coffey and all her members, all the nurses that I've worked with over the years. Heart and soul of the system, we hear you, we value you, and we want to continue to work with you as we redevelop and reimagine a healthcare system for the future. But it is easy to criticize. This is a solution-driven process, and we recognize that it will take time, short, medium, long-term, Brian, and we will continue to enact along the way and change and adapt according to the feedback that we received. Thanks, everybody.